When intimacy burns, stings, or vanishes, it's not your body betraying you. It's your body begging for help. I want you just to exhale and just feel that for a moment, just like letting that in. Like for those of you that needed to hear that, it's good. It's good. Just let it in, right? Like it's not you, okay? There is a problem and it can be fixed. So let's talk about it, right? I think this conversation is long overdue. A lot of times these things are just very much pushed under the rug, right? Where pain with intimacy is common, but it is not normal. And most women never even get the chance to talk to their doctor about this. This is usually like kitchen table or bar stool conversations, right? Or women's bathroom conversations, or those, those really concerning phone calls you have with your BFF about like, hey, something's going on and I don't even know what to do, or maybe it's just not a problem at all. But it's a problem, can tell you. I'll be your BFF. I remember I was really young, a real long time ago, watching TV, and this woman said, "I'd rather have a sandwich than have sex." And I thought, that doesn't really make a lot of sense. I mean, I love a good sandwich. In fact, it's ridiculous how much I would love to have a great sandwich. And where I live, great sandwiches are not available. I don't know, people just don't make great sandwiches here. But when I grew up, sandwiches were great. And I love sandwiches and I love them, but I still think most people would rather have a really healthy, vibrant sex life than have a sandwich. I mean, why not have both? Getting back to the fact that if this is your problem and you don't even have the time you're in your doctor's office to talk about it because you've got a lot of other priorities, but this one matters. Okay, this is a priority. So let's make this a priority for this podcast episode. Hello, welcome. This is a Feel Better, Feel Great podcast. This is episode 177. Sex shouldn't hurt. Pain is a signal, not a life sentence. So, in every episode, I really work hard to think about things holistically and offer them to you. I'm a functional medicine doctor. I want to empower you with knowledge so you have a happier, healthier life, right? And I am your host, Dr. Andrea McSwain. If you're new to me, or if you haven't yet, please take a minute and click on this because I want to get you great information. Okay, so subscribe, click on the channel. I do post content once a week. So remember, please, though, that this content is educational only. I have been a holistic doctor and a gynecologist, and I'll just say it like it is. I think my patients have come to appreciate that. I'm going to do my best to help them. And that's about having the conversations about reality. And so I want to just get that out there. But it's not medical advice, right? It's medical education. So then you have options and then recommendations that you work with your doctor with, just to clarify. But you need the education in order to have the options, in order to get the right recommendations and find the right doctor. That's where you get great recommendations. So let's talk about it, okay? Because some of the things that happen basically is, tension in the tissue. So if there's pulling, tugging, burning, right? That's a tissue problem. That's a hormone problem, right? Now, if there's tenderness, right? And then sometimes that can happen with nerve stimulation, right? And so sometimes these can be a little overly tender, right? But there's the balance there. So if you're feeling a lot of tension, pulling, tugging, burning, not right. Tenderness, receptivity, maybe even overstimulation a little bit, those are much more on track for a responsive tissue. And then the other thing too is a lot of times if you're feeling a numbness, that's also can be a problem with the tissue, right? And you disconnect from the emotional dynamic that comes with comfortable intimacy, safe intimacy, and joyful, right, intimacy. So that's when we build the connection. I definitely have had patients come to me, and women and men, and think maybe I'm just not in love anymore, right? Like I don't feel anything when I have sex. I don't know. It hurts. So it's not worth it. I'm possibly even the idea of being somewhat allergic to this other human being who is my spouse, right? Like, okay, because I'm kind of, it's off-putting, and I don't want to be next to them. Okay, well, that's something I've already addressed in a previous episode on intimacy in general. But this is also like sex is painful. It hurts. I don't want to do something that hurts. My body's telling me if it hurts, I shouldn't do it. Let's twist that around, okay? If your body's telling you it hurts, it might be telling you there's a problem, and that the problem needs to be addressed so that you can have comfortable, joyful, safe sex, and that you haven't fallen out of love. So I definitely encourage people to look at PRP injections for this. For gyne, there's also the male version. They're often called the O shot or the P shot. I just call it PRP vaginal or PRP gyne, because there's a bladder element as well to it. But that's a side note. Okay. And I do want, though, you to also think about that. I've had people who are scared of being divorced because women, they don't want to have sex with their partner, and their partner is put off by that. Go fig, right? Like, I think that you should really recognize that if you don't want to have sex with your partner, some things need to happen, right? And so, or even worse, someone who, I had a woman in my practice in her mid 30s, and she wanted to have sex with her husband. She had so much tissue destruction due to some autoimmune disorders that it was incredibly painful, because the tissue had been destroyed, and not permanently, but it needed rejuvenation. And after, a few in this situation, I think 3 PRP injection series of 3, it was amazing. She was having sex, enjoying sex, and her husband was happy because she was so concerned that there was a divorce on the horizon. And that's a lot to contend with, especially when you can do something about it, and especially when you want to be with your partner and have intimacy. But if there's pain, that's hard to do, but we can fix it. Okay, we can definitely address it, and I can give you education. I can't fix it over a podcast episode, but I can definitely give you education and more options probably than you ever knew possible. All right. So what happens when you have painful sex? Like, what's the physiology, right? Like, what's happening? That's kind of physiology, is like what's happening. Women have tissue, right? So there's the outer layer called the vulva, and then there's the inside tissue called the vagina, right? Vulva is much more like skin, and the vagina is much more like, it has a plump and a lot more muscle tone. Okay, so we're gonna get into the vulva because um, and you should just know, with vulva and vaginal tissue thinning, it definitely is a lot about estrogen, DHEA. These both keep the tissue plump, hydrated, right? And then also, when we look at, like, when levels drop in certain times, stress. Anyone? Obviously, after having babies, or just it happens after having a baby and it continues, right? And then there's tissue destruction with scarring and things like that. Birth control, definitely levels will drop with hormones, right? They kind of flatline and zombie out. So bye bye libido, and bye bye tissue integrity, potentially. And some people do great with birth control, but if you're here, you want to hear that. As we start losing vitality, some people call that perimenopause, with stress and adrenal exhaustion, right? And then menopause, when our sex hormones drop below the level of having ability to reproduce. All right, so what can happen? The tissue becomes dry. And when it's dry, it's tight. Think about, like, I always think about, like, chicken's been, like, fried too long, and that skin is, like, really, like it's shiny. It's really, really tight, and it frays. Those are micro tears. So that can happen in vulva and vaginal tissue. And that means there's no elasticity, right? Think about that fried chicken piece on the frying pan, right? Like, there's that, like, dry, breaking apart, shiny, irritated, instead of, like, supple, moist, right? Like, some people don't like that word, but supple, pliable tissue with a good muscle tone for contraction. It can handle friction and tension that happens with intercourse, Okay. So, and how can that happen too? Yoga pants or athletic pants, a lot of polyester trapping in moisture and pathogens, just a breeding ground. And so, in boys, we call that crotch rot, right? Like they keep their bathing suits on all day long and they're in and out of the lake or the pool and they get crotch rot. They just get this nasty, like overgrowth of the the biome, but it's really like it itches, it irritates the skin, it can even like degrade the tissue. So crotch rot is yoga pants. So if you're like going out to the lake or you're like, I'm gonna look great all day long, and you're in a even not even particularly a warm place. Let's say it's summer, you have some yoga pants on all day long, they're extra polyester. In fact, that's most of them are synthetic. They're tight as hell. And yeah, you might look great, especially with the kind that like arch in the back. So you get like this really great, like full effect in the booty. But anyway, you've got this like going on. You're like, oh my gosh, I look great at the grocery store. I look great at blah, blah, blah. You don't, it's not great. Okay. Because it's causing basically crotch rot. So if I think I'm changing people's lives just knowing that. Like, take the yoga pants off, take off the exercise pants, do not wear them all day. They are not designed to be worn all day. And maybe watch how that changes everything. I had a patient who just loved going out on the lake. She didn't necessarily, she'd go on the boat, she'd go on the paddleboard, she'd, not necessarily swim, hang out on the beach all day long, 5, 6 hours wearing these yoga pants, and she's sweating, it's collecting pathogens. It's like a breeding ground, and the tissue, because of estrogen depletion, was just a nightmare. It was thinned, it was shredded. Even, I mean, that's a horrible feeling. Um, Not to mention you have to go to the bathroom and urinate over that raw tissue is incredibly inciting for more problems, more pain, less interesting and having penetration. So anyway, remember, it's not in your head. I mean, if you've gotten here and you don't realize it's not in your head, then I'm going to tell you it's not in your head. It's in your cells, it's in the tissue. It's what's happening. It's big deal. Another one is pelvic floor hypertonicity. So the pelvic floor gets really tight. It's like holding stress and tension. Also, how we sit. Oftentimes, people sit not up, where their tailbone and their booty are at the bottom, but they actually sit like rounded. And so then you end up like pressing your tailbone into your pelvic floor, and that's a lot of tension, and causes a lot of problems. So, um, anyway, I do like talking about that hyper tonicity. One of the things to think about is, of course, just feeling that middle of the perineum opening. And so you roll your inner thighs in a way together, and it pulls apart that middle space of your pelvic floor. That middle space is your perineum. That middle space gets your muscles to stretch in a really healthy way. That's actually the bottom of where, like right next to the bottom of where the vulva entry is, called the introitus, and that is where a lot of people have sex, is upon entry. So you're actually stretching your genitals. And that's giving blood flow, sensation. It's getting organized, not just in the bones, like the tailbone, but the tailbone is really connected pretty above that to the spinal cord, right? So you're dragging your tailbone and tucking it under, and you're sitting on that. You're dragging and tucking some of your nerves that are feeding your pelvic floor. So there's some nerve. Also, the blood supply can be constricted in this motion. So again, roll those inner thighs together to allow that space to open and pop up and sit on your booty instead of sitting on your back. And that will make the nerves organized. That will help you. That's a big, long, beautiful, long conversation that I would love to have more of. And of course, this one also, like, okay, yoga pants, like, no to yoga pants, right? Like, yeah, yoga or exercise class, yeah, 45, 60 minutes, whatever, but not 4 or 5 hours, like, seriously. And then the other one, like, so that's part of the microbiome destruction or disruption, but can be like super off-putting. Okay, harsh soap. So this soap should just run down, right? It shouldn't like get all scoured, and it should run down. You should be able to clean hair if you have that, and just kind of like, be gentle, very gentle. Dr. Bronner's non-peppermint, could use a little lavender, that can help. There's actually a little estrogen in lavender, so something to think about. And then, oh my God, scented wipes are harsh, harsh, abrasive techniques on a tissue that's already sensitive, right? It's like at some point, it can almost feel like you're touching a scab. There's a lot of nerve endings as well in the pelvic floor area. So I would even say sometimes wiping can even be very, very painful. Sometimes people will just use a little squirt bottle or a bidet or a little hose they attach to their toilet so they can clean without wiping. Because toilet paper is usually pretty toxic and it's paper, it's harsh. It's like when you blow your nose too much, right? Oh, that's another one. Don't blow your nose on the toilet. Oh my God. I know we're talking about painful sex, but you blow your nose on the toilet, you are introducing your nose microbiome into your vagina. Do not do that. I strongly caution you against that. Okay. And then, obviously, when there's a gut microbiome disruption. So, we have a vaginal probiotic, or we call it women's probiotic. And that idea is it definitely gives you an oral supplementation, but it actually gives the bacteria of the vagina. So when you're looking at probiotics and you have a gyne issue, women's probiotics are specially designed. And make no mistake about that. So sometimes if you're in an acute situation, you might want to double up. Otherwise, sometimes people use it for maintenance and they might use one capsule a day. So I have a patient who, patients come in, I say, hey, think about 2 capsules for the next 2 weeks and then go down to 1 capsule daily until this is gone. And truly it can go away. Yay. You can heal. But just know that there is a microbiome that is specific to the vagina. And that's where inflammation happens. That's where sometimes recurrent yeast happens or bacterial vaginosis. They're a microbiome disruption sometimes, as opposed to a infection. In fact, they are also hormone related. If you were taught to scrub yourself to cleanliness, you were also taught to inflame your skin. So e- that's just don't do that. All right. So let's talk about the hormonal connection and healing pathways. Right. So estrogen, progesterone, DHEA, they nourish mucosa. They keep that tissue vibrant, vital. Cortisol, stress, deplete them. So if you're in your 40s and you have like great job and you have a spouse or you have a significant other and you have children and you kind of feel like you have everything and yet you have nothing, you have adrenal stress. And so that probably means intercourse is going to be like not that great because your sex hormones are going to go down. So adrenal stresses like cortisol, another one called aldosterone, they're cattywampus. And then as a result, sex hormones are disorganized, depleted, etc. Birth control, as I mentioned, it flattens libido for most people. And then it also declines the hormonal levels. And it confuses the hormonal rhythm. That's a lot of it. And then that affects tissue health. So can like just physiologic stresses like overtraining. I mean, like seriously overtraining. Some people maintain a normal flow with frequency when they train, and some people it's too much for them. So those are some considerations. I definitely love thinking about how to restore those tissues. So again, I mentioned like women's probiotic, obviously omega-3s. I love KPS Essentials for their vitamin C face and body and their charcoal mask. So when you are talking to me and I am talking to my patients or people, I really strongly recommend they apply the vitamin C to my patients. I recommend they apply the vitamin C in the morning and the charcoal mask at night. And that those quality of products are so remarkably good that the healing happens. It's a big win, especially when you add that with vaginal PRP. Like then you're like, woohoo! And that's what we want to feel. we want to rebuild the circulation. We want to improve pelvic floor capacity. Sometimes people work with pelvic floor therapists. Sometimes they'll work with osteopaths. Um, and then sometimes they don't even know they have these problems, right? So that's like a big deal. So I had a patient come in who had, she actually was a pelvic floor physical therapist, but she had had a really traumatic birthing experience. And there was just so much scar tissue. So that's one of the things with pelvic floor physical therapy. While it is absolutely remarkable, it still that doesn't have the capacity necessarily for tissue rejuvenation as quickly as platelet-rich plasma injections. So when people are, using pelvic floor physical therapists, it's a lot about biofeedback and organization and coordination of the tissues and fascial release and organ health, right? But an organ like allowing the organs to actually be able to move because the scarring and the disruption don't allow them to move, so then they don't work very well. But if it's a situation, right, the tissue is just like solid mass, super tight, or it's so scarred, it's obvious, it's not pink anymore, it's white or gray, and it looks like it's a fried chicken breast, like on the stovetop. Then that's where you got to get the tissue restored. And you can use those products from KPS, the vitamin C face and body, the charcoal mask, and those are phenomenal. And they help with tissue rejuvenation because they're nourishing, they move out toxins, things like that. But at the end of the day, sometimes just platelet-rich plasma injections are like it's like flying an airplane or a rocket ship, right? It's like rocket fuel to the solution. Anyway, I definitely wanted to get that to you. Just the other layer there, and there's a few things, right? So when you have that nervous system emotional layer, if you're hurting, you're not going to feel safe. Like it's just how it is. Like the brain goes into fear and pain processing. And this in thinking brain, the objective brain, is a lot about information processing, but the fear brain is about pain processing because that's about survival. So pain connects to survival, connects to the fear brain, the reptilian brain, right? And there you are, right? So not only that, it's probably not the most receptive time either. You're in fear reptilian brain, which means you're focused on survival. And when people are focused on survival, they're not focused on like recreation procreation, right? So however that decision is for why you might have intercourse, the idea is if you're in fear brain, you're not focusing on joyful intercourse. So we have to make you feel safe, right? We have to make the nervous system feel safe. We have to get into feeling sensation and not feeling tension and pain. Okay. And so we start to get into a cycle where pain creates anticipation, and then anticipation creates pain. I have seen that. I have seen that in how people who have a lot of repetitive strain injuries will actually be afraid of something before it even happens, and they'll live that in their body. So if you have kind of this cycle, and you get into this cycle, and with intercourse, and that's involving some other person that you love, then you get in this pain, anticipation. You just anticipate that it's going to hurt, and keeps you in your fear brain, and it keeps you unsafe, and then it keeps you withdrawn as a protective mechanism. So we've got to unravel some of these things. So you definitely want to take a minute and think about, oh, does that resonate with me? Is that like what's happening? Like my partner comes towards me and I'm like, I'm over there, or oh, I have something to do, or oh, I forgot that at the grocery store, and then if and because you're anticipating, when we have pain and then we start anticipating that we're going to have pain, you start to see how the ramifications of that work with like deflecting or not wanting to have touch and bracing yourself potentially, which is very off-putting. So connecting again to your body, connecting to its messages, and awareness, okay, that if you have pain, true. Now do you have anticipation of the pain? Okay, that's a deeper layer, and it comes with awareness. And is that what's putting this off? And then is that what's then just saying like I'm trying to protect myself, and then you wouldn't go into the healing elements that would actually make this get addressed and potentially resolved. So think about that. Um think about relaxation, and think about pacing intimacy sometimes. But truthfully, if you're hurting when you have sex, there's only so much you can have cognitive behavior therapy for, right? It's the truth is your tissue's messed up. It's got to be fixed. It's hormones. It's a scarring. It's unhealthy tissue. Bammo. So you cannot feel pleasure and fear at the same time, right? Safety is the first aphrodisiac. You cannot feel pleasure, right? Because that's here, that's connection, that's awareness, that's uh, you know, receptivity, and fear coming from the brain at the same time. So when people feel safe and they feel comfortable, then they feel like they can open themselves up, right? But remember, there's a psychological component to this, right? But there's a physical component as well. And I don't want anyone here to feel like shame. In fact, hopefully this whole episode is just like blown all that out of the water, right? You have so much objective information. You have so many ways to get better. You're like, "Hey, I'm good. I can process this." I'm like, "Yes. That's what I want. You're in control." When you're in control again, it's like, "Yes. What can happen?" And you get in your objective brain and then you get motivated and it's like, "Ah, and it feels so good to have that kind of power." And it makes you feel like you can have some communication, and also just talking about something that can't be addressed is like, it's like horrible, it's annoying when you don't have control, but now you have control because you have so much knowledge, education, so you have options. Okay. And what we want to do is not get into how partners like start interpreting that the lack of intimacy from tissue disruption has anything to do with actually how they feel for each other, but that happens all the time. And that's a huge, it's a huge barrier, and it's unfortunate because it's something that we can address. Just want you to feel that safer connection. And please remember that, again, as I mentioned, pain is information, right? So pain is a message. Okay. It's a warning sign, right? It's begging for help. Your body's not broken, it just needs help. We have the inherent ability to heal. That's the coolest thing ever. And so we aren't just stuck in a way, we aren't stuck in anything. Okay, so just remember that. And then, tissue health, hormones, the nervous system, these are all partners in the dynamic of having pleasure, of having objective data that makes us feel good. So I want you to just process that, right? Tissue health, hormones, and the nervous system. These are all partners in developing your connection, your sense of safety and joy and pleasure. So, just checking in with yourself with that. Does your body feel safe, nourished, respected? Right. And maybe too, I often like try to help people like where you are and where you want to be, where you were before, where that made sense in your body, and like where you don't ever want to be. Right. So, like, thinking about like, when did it feel good? Like, when did it make sense? Like, how can I trust my body again to have those sensations? Right. And what would happen if I didn't get this taken care of? Again, stop guessing. That's what I would say. Start testing. This is one of those places where, again, you are in control. So if you stop guessing what's going on, you've gained some awareness from today. I really encourage you to take action. I really encourage you to start finding the answers for yourself. Unfortunately, so often you're just stuck looking for answers, and people are going to Google like they've done for like 20 years. Like, that makes sense. Now we have chat, and those are predictive models, and they don't often talk about some of these things because it's not really there. And then they give this like random ideas, blah blah blah. Don't you know you want to learn, but you want to learn in a way that actually moves things forward, and you want to get things started. So getting stuck in like education consumption paralysis is really not getting your goals addressed and met. So I want to make sure you know that and you know steps to take. So thank you very much again. It was my pleasure to present this to you. Please make sure you subscribe if it interested you and you want more. All right. Thank you.